Next, we're going to observe the shape of your tongue. This is very easy, very straightforward. You're going to do this in front of a mirror. If you're doing this on your child, you're going to have them lie on the floor and stick their tongue out. Here, we're looking to get information about the relationship between your tongue and your palate, as well as look for more signs of a restricted lingual frenulum or higher grades of a tongue tie. And just observe the general tone or muscle activity of your tongue at rest. First thing we're going to look for is scalloping. So you're going to stick your tongue out. Okay, and what you're going to do is look for ridges around the outside of your tongue. And if you look at my tongue when I do this, you'll see a little bit of ridges or scalloping on either side. So right there you see some scalloping. Now, scalloping is literally the indentation of your teeth on your tongue. So this tells us there's some kind of relationship in which your palate is either too small to fit your tongue inside of it, or your tongue is too large, potentially due to decreased use and coordination of the tongue, which is not allowing it to fit inside of your palate. Typically, there's a combination of these two. In very rare cases, your tongue may actually be genetically too large. This is very rarely the case, and I wouldn't resort to this assumption firsthand. Two other things we're going to look for in terms of shape is when you stick your tongue out, is there a dimple at the very center of your tongue? So it would be right in this range here. Okay, that gives us a little bit of information about whether the frenulum underneath your tongue is pulling downward, and that's where you'll see that dimple, which is going to limit your range. Another very clear sign of a higher grade tongue tie or tongue range of motion limitation is if you have the very center of your tongue kind of pulled down to the base of your mouth with a string looking structure, and then the outside parts of your tongue are sticking up because your tongue's trying to go out, but it's tethered to the floor of your mouth by that frenulum. That is a very, very clear sign of a higher grade tongue tie. You'll notice your tongue kind of looks like a heart in that position. And then the last thing we're going to look at is just general tone. When you stick your tongue out, is your tongue very wide or does it stay very, very narrow? Again, that just gives us a little bit of information about what your tongue is doing inside of your mouth and which muscles are working all the time and which ones have a harder time working. Write these observations on your comment section of your assessment form so that we can use them at the very end to have a better diagnosis of what might be going on. And then if you don't have a self-assessment form, you can enter your email in the link below, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along as you go through these videos. If you have any questions about this observation test or any of the tests that we've done previously, please write your question in the comments section below, or you can find me on summerspt.com. Also, you could reach out to your local myofunctional therapist.